With osteoarthritis or degenerative joint disease, which is the most common reason that people require knee replacement, there is a subset or group of patients that have arthritis mainly just in the medial aspect of the knee. It's a disease process called anteromedial osteoarthritis. It's significantly painful. The pain is typically over the medial aspect of the knee. Those patients also typically have an intact anterior cruciate ligament and typically have good range of motion. If people meet those criteria, they may be a candidate for partial knee replacement of just the medial compartment or just the inside part of the knee. The replacement is called an Oxford knee replacement, and I've been doing them over the course of the past 15 years. It's a less invasive or minimally invasive surgery that doesn't require cutting through any of the musculature to enter the knee joint. With respect to the replacement, as opposed to replacing the entire coating of the distal thigh bone and top of the shin bone, it's actually a much smaller component just on the inside part of the distal femur and proximal tibia. So there still is a metal cap, but just over the inside portion of the distal femur, there still is a small metal cap over the proximal portion of the shin bone or tibia on the inside part. There then is a mobile bearing plastic or polyethylene spacer which fits between those. The big benefit is that again, it's a less invasive surgery. People typically get their range of motion strength back much more quickly. It also maintains people's normal anterior cruciate ligament and posterior cruciate ligament, so the knee tends to function more normally as compared to a total knee replacement.